Hi, my name is Lexi Furnish, and I am a Master's of Athletic Training student at Manchester University. Today I'm going to be talking heart rate measurement. It's highly important that you have the skill mastered as an athletic trainer because a heart rate of a patient or an athlete can tell you so much, not only about injury and illness, but also about just general fitness level. To begin, we want to take two fingers, your index and your middle finger, not your thumb, and these are the fingers that we're going to be using to feel the pulse. And then we are going to do this in two locations today. The first is going to be the radial, which is on your wrist, and the second is your carotid, which is found on your neck. So to begin, we're going to look at the radial pulse. That is the radial artery, and as the name describes, it's right by the radius. So all you have to do is find your radius, which is on your thumb side, and everyone's a little bit different. So if you don't feel it at first, just wait and it'll come. So if I can show you, my radial pulse can be felt right here. So next, you will count, or you'll count by watching a analog clock or watch next to you. So I have one on the back wall. So we're going to go ahead and say you can count for 6, 10, 15, 30, or for a full minute. Heart rate is measured beats per minute. So in order to get that data, we will then measure by the correct multiple to get to 60 seconds. So that means if you're using a 6-second interval, you're going to multiply the number that you number of beats you count by 10. If you're using 10-second, then you're going to measure, or you're going to multiply it by 6, so on and so forth. So we'll go ahead and count. So I had 19, and we were going by 15 seconds. So what we would do is we take that 19 number times 4, which is 76. So that means that my beats per minute is 76 at a resting state. So then the second location that we talked about, or that we're going to talk about, is the carotid artery, which is found, you can find it on either side of your neck. It's just under your chin. Mine is right here. So again, it's the same principle. With this one, you do want to be a little bit careful. You don't want to put too much pressure, and you definitely don't want to try to measure on both sides of your patient or your athlete. So again, you can use the different multiples and multiply it by the appropriate associated number. This technique of measuring a heart rate is very efficient while you're in the field due to the fact that all you need is a clock or a stopwatch of some sort to count the seconds while you count the heartbeat. It would be very difficult if it was an emergent situation and you're trying to collect vitals to try to fit one of the heart rate belts on, or if you don't have the portable pulse ox, it would just be very difficult to collect it any other way when you're in a hurry, when it could be life or death. But we also have to take in consideration human error. What if I miss a beat? What if it was faint and I didn't hear it? What if I can't find it? Which, in that case, the belt that I was describing earlier that you wear under your chest, and you have it show up on a watch on your wrist or on your phone, or if you have that pulse ox that you can put on the index finger, that'll give you the oxygen saturation and the heart rate. Those may be a little bit more effective and accurate, but like I said, when you're in an emergent situation, you're not going to have time to do any of those. So just the old-fashioned manual heart rate technique would be the most efficient at that point.